Hello and welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. Alarming growth in antifungal resistance tracked over 30 years in Dutch study. A comprehensive study published in the Lancet Microbe reveals a worrying rise in fungal resistance to antifungal medications, particularly in the common fungus Aspergillus fumigatus. The study analyzed more than 12,000 lung samples collected from Dutch hospitals over a 30-year period. Since 1994, microbiologist Paul Verwij and his team have been collecting A. fumigatus isolates from patients' lungs. In the early years, no resistance to antifungal drugs was detected. However, by 2000, a significant DNA mutation was identified that led to resistance. Another key mutation followed in 2009. Over time, numerous smaller genetic changes have also emerged, often appearing in combination, contributing to increasingly diverse and drug-resistant fungal strains. We now have collected about 2,000 resistant fungal strains, 17% of which show variation in resistance mutations, says Verwij. Importantly, these resistant strains nearly always appear as mixtures in patient infections, making treatment more complex. Feeling alone? Study warns of serious mental and physical health risks. Loneliness is a powerful predictor of depression and deteriorating health, according to a new study published in PLOS One. The study analyzed data from the Behavioral Risk Factor Surveillance System, which collects nationwide health-related data via phone surveys. Researchers examined responses from 47318 non-institutionalized US adults between 2016 and 2023. The participants were predominantly white, female, and between 18 and 64 years old. The findings were striking. More than 80% of respondents reported experiencing some levels of loneliness. Those who described themselves as always lonely had a predicted depression probability of 50.2% compared to just 9.7% for those who said they were never lonely. Even low lead exposure may accelerate memory loss in children, study finds. A new study published in Science Advances reveals that exposure to lead during pregnancy and early childhood may significantly speed up the rate at which children forget information. This crucial marker of memory impairment may have profound implications for learning and cognitive development in young children. The study focused on children between ages 6 to 8 and assessed their working memory using a cognitive test called the Delayed Matching to Sample Task (DMTS). This test evaluates neurobehavioral functions like attention and working memory by requiring children to identify a previously seen image from multiple options after a short delay. The DMTS has already proven effective in detecting sensitivity to neurotoxicants such as heavy metals. Is air pollution quietly increasing brain tumor risk? Air pollution may not only damage the heart and lungs, but could also increase the risk of meningioma, a typically non-cancerous brain tumor, according to a new study published in Neurology. The study does not prove that air pollution causes meningioma, they only show a link between the two. The study, led by researchers from the Danish Cancer Institute, analyzed several air pollutants with a focus on those commonly associated with traffic emissions such as nitrogen dioxide and ultrafine particles. These microscopic particles are particularly concentrated in urban areas and due to their size can potentially penetrate the blood-brain barrier. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.